Greetings, everyone. My name is Emily Louie, and on behalf of Campbell Company, I would like to welcome you to Healthcare and COVID-19, Sharing Challenges, Successes, and Advice. We want to thank you all for joining us today and hope we can provide some relief during this difficult time. Before we begin today's presentation, I'd like to quickly go through some logistics for those of you who may be new to our webinars. First, please close any programs other than GoToWebinar that are running on your computer. Next, we recommend calling in with a telephone instead of using your computer speakers. And if you do experience any visual issues, please send a chat to Campbell Company or contact GoToWebinar at the number on your screen. Today's webinar is being recorded and will last 60 minutes. Within the next 24 hours, you'll receive an email from GoToWebinar that includes information on how to access the recording. We do welcome questions throughout the webinar, so please use the questions box in the GoToWebinar control panel that should be on the right side of your computer screen. We will also hold time at the end of the webinar for Q&A. And with that, I'd like to turn it over to our presenters today, Senior Consultant Minhaal Nathani, Senior Consultant Jacquelyn Peters, and Vice President Adam Wilhelm.
Great, thanks Emily. Hello and welcome everyone. My name is Minhaal Nathani and I'm based in the greater Los Angeles area. I've been with Campbell Company for a little over a year, but I've worked in development for over 15 years, primarily with higher education and healthcare organizations. Prior to joining Campbell, I was a senior director at a comprehensive cancer hospital, raising funds through major and principal gifts for various service lines. Thank you for joining us today.
Thank you, Minhaal. My name is Jacquelyn Peters. I'm joining you from our Chicago office. I've been with Campbell Company for about 5.5 years now, and I also have a healthcare background. Since being at Campbell Company, I've worked with a range of organizations within the healthcare sector, everything from community hospitals to medical association foundations and retirement communities.
Thank you both, and it's good to see that our real video images look just like our bio pictures, so we're aging well relative to that image capture. Thanks everybody for your time today. Glad to have you join us in what we know is an extremely busy time for all the organizations involved in healthcare fundraising. My name is Adam Wilhelm. I'm a vice president with Campbell Company. I'm also based out of our Chicago office, but do work all over the country. I've been with the firm for almost 12 years now. And during that time, I've had the good fortune to work with traditional healthcare organizations, from small community hospitals to academic medical centers, as well as outside of traditional healthcare, with blood organizations, healthcare-focused professional associations and societies, and voluntary health associations as well. So we're looking forward to sharing a little bit with you about what we're learning over the last 30 days, learning quickly, and also some experience that we have from previous downturns as well, and look forward to answering your questions. So as I said, we'll move into some of those learnings. We want to give you what we're hearing from clients, but also what we have in terms of recommendations going forward. So just to start out, and really these are things that we're sharing with all organizations, but also specifically with healthcare organizations. Based on our experience during other challenging moments, whether it be 9/11, the dot-com crash, the Great Recession, here's what we know and here's what we've learned. Donors will not stop giving. I think that's an important point for everybody to understand. The trains are not going to stop fully. That said, they will narrow the number of organizations they give to, generally focusing on their top 2 or 3 or 3 or 4. So if you had a donor who was giving to 10+ organizations, as they look to constrict their personal budgets, or if they're institutional funders, they look to focus their grant making, they're going to begin to focus. And we're seeing that happen already, even over the last 30 days, and specifically focusing on what they might consider to be basic needs. And I think for many of us, especially in the current situation, we have the case to make that healthcare is one of those basic needs. Something else that we've learned is that donors will take longer to make decisions about significant gifts. And if they're individual donors or institutional donors who are backed by significant endowments or foundation assets, they're gonna take longer to make those decisions. And again, we're starting to see that happen already. So we encourage you to stay patient, stay the course in those conversations, but do build into planning that it might take longer to close those opportunities. During the Great Recession, when we monitored campaign activity very specifically, the vast majority, so 95% plus, which for us was basically, of the 200 or so campaigns that we were working on during that time period, the vast majority of those met or exceeded those goals. The relatively small percentage of those that did not, those were campaigns that were already in trouble. So for whatever reason, be it volunteer leadership loss, executive leadership loss, or other environmental, institutional, contextual concerns, they were already in trouble. Some organizations did extend their timelines by 6 to 12 months in order to meet those goals. But again, those that were even in the beginning, the middle, or closer to the end, did eventually meet those goals. The last point is hopefully what you've been hearing. I know there's just a deluge of information and consultants looking to share their opinions about what you all should be doing during these times. I think the most important piece of advice that we can provide, that we've learned from previous and that we've learned today, is that organizations that stay in close touch with their donors, especially your mid-level and major donors, right, who make up a large percentage of your pipeline, will fare much better than those who did not. So this was proven during the last recession. Don't put annual fund plans on hold. Don't put major giving plans on hold. You have to continue to stay in touch, even while acknowledging the unusual context that we're in right now. Donor retention is obviously one of the most, arguably one of the most important metrics for us to continue to measure. And so that's an important learning from previous challenging times as well.
Thank you, Adam. Now we want to spend a little bit of time talking about what we're hearing from other healthcare organizations. I welcome Adam and Minhaal to chime in with any stories or client experiences that they have as well. I'll walk through each of these 3 sections, and we can share some of the stories that we've heard from clients, and hopefully it's something that you can relate to. It's something that you're maybe experiencing yourself. So there's a little bit of solitude in knowing that you're not the only one who's going through some of these challenging moments. So from hospital leadership, we're hearing that medical staff, hospital leadership, employees, et cetera, are not all that, are anxious and not all that interested in philanthropy. And those frontline fundraisers, or those frontline workers rather, are focused on their primary responsibilities in patient care as opposed to fundraising. So what we're hearing is that this can take a couple of different shapes, namely leaders within the organization who may have been participating in conversations and cultivation activities with specific prospects may want to put a slight hold on that, or it's an elongated timeline to facilitate those conversations because their attention is needed elsewhere. So they have limited availability to spend on fundraising. And we're also hearing that some of the really great service line and grateful patient work that's happening, that too is on hold to some extent, as it includes and engages frontline workers, as they don't have the time to spend with the fundraising team to think about prospects or do some of that prospecting work that we know is so important to a grateful patient program.
And just to add to that, I think, some parts of your hospital system or organization may be more impacted than others in regards to response to COVID. But for example, you might have been in the midst of an initiative for a particular service line or facility or piece of equipment. And I encourage you, and we're seeing specific examples of this, don't put on hold what was ongoing. So even though we've shifted largely to an all hands on deck mentality, it's important to maintain and sort of keep watering other initiatives that you've had ongoing. You don't need to be delving as deeply into it as you had been in previous months, but if you let anything lie fallow at this moment, it'll be that much harder to pick it back up. So obviously be cognizant of the attention that's being pulled away in response to the virus, but also be cognizant of keeping something floating, even if you can't pay as much attention to it as you had previously.
Thanks, Adam. What we're hearing from donors. So donors want to know how you're responding, how you've been impacted, and how they can help at this moment in time. Some are concerned and anxious, but others are looking at this as an opportunity. And ultimately, as Adam had mentioned on the last slide, donors are still giving. So we're seeing that in certain instances, especially for healthcare organizations, there can be an increase in giving to COVID-19 related response efforts. And there's also, I've heard of some board challenges where the board chair perhaps is leading an initiative to raise X amount of dollars to support your immediate needs. So we're hearing that there is a response from donors, that donors are still giving, and in some cases, there's an increase in giving and an increased number of new donors, especially for some healthcare organizations.
Yeah, and just to build on that, I've had multiple clients receive proactive outreach for challenge funds in relationship to COVID response, and this is obviously a good thing, right? But makes you move quickly to sort of put up the logistical infrastructure in order to respond appropriately. I think the best piece of advice related to this that we're seeing those funds designated as broadly as you can. We saw some organizations get really narrow in the definition of what the response fund could go to, and then had to switch up as things move forward. So keep that broad, and be cognizant of not issuing too many one-off challenges as you move forward. The other thing I would say in terms of donors, we want to make sure that we're giving donors the opportunity to tell us how they'd like to interact with us at this particular moment in time. We can't assume that they don't want to be contacted or they do want to be contacted. We have one client where they had confirmed the naming gift over the last couple of months, and I think it was, in terms of negotiating the final details, was delicate, and they decided to put the announcement of that naming gift on hold for the time being, but continuing to keep that conversation going is important. So don't assume, one way or the other that donors do or do not want to be communicated with.
And from fundraising teams, gift officers may be hesitant to reach out to prospects. Meetings are all moving to a virtual landscape, and staff is continuing to meet, and in some cases more regularly than they may have before. Events are being canceled or postponed, and in many cases that includes a giving day. Teams are adjusting their metrics, so looking at metrics beyond in-person visits and thinking about contacts by way of email and phone as being equally as important. And balancing virus response messaging with other outreach priorities is a key challenge, and that's something that Adam just mentioned. I'm working with one client who is thinking about shifting many of their major gift officers and their major gift outreach to annual fund outreach, in the attempt to get their major donors and major gift officers a little bit more comfortable with those conversations. And also not asking for major gifts right now, but keeping that line of communication open about giving and giving towards the greatest need to the COVID-19 response and just general operating.
Yeah, and in terms of fundraising teams, I'm seeing two things happening here with our clients. One is people are just generally absorbed with the logistical response to the changing environment. So communicating with board members or other volunteers, communicating with medical and executive colleagues, and that basic administrative response is taking up a lot of what was previously fundraising time, which is understandable. And so it's just something that we have to deal with at this particular moment. But in terms of the broader team, people are working at home, and my general observation is that people are having a hard time being proactive or as proactive as they could be with donors. And so I just want to emphasize what a great time this is to be in touch with donors. Everybody is home. Everybody is thirsty and wanting to know. I mean, we're all getting information from the news and social media on a minute by minute basis, and they want to know what's happening at the organizations that they care about. So it's a great opportunity to be in touch with your donors, not about a specific solicitation or gift opportunity, but just to ask them how they're doing, what's going on in their lives, listen and empathize, and also offer them news about how your organization is responding at this particular time, and maybe even getting in the weeds more than you would at other sort of normal times.
Okay, thank you, Adam. Now I'd like to share some recommended strategies for navigating the current environment, many of which Jacquelyn and Adam just covered in the previous slide. First of all, communication is key. While we know relationships with donors are long-term propositions, immediate and effective communication is key to sustaining a relationship during a crisis. We know that healthcare is at the epicenter of this pandemic, and keeping donors updated about how your healthcare organization is part of the solution reminds them of their role in being part of the equation. A good strategy here would be to create a clear short-term communication plan that covers what the key message themes will be, how communications will be sent, when they will be sent, and who will send them. Now more than ever, the nonprofits need to make their donors feel connected to the mission of the organization. Yes, you should show empathy and concern for your stakeholders, but also keep educating your donors about your programs and the impact they have. Let them know their past gifts are appreciated and useful. It's a good time to ask for advice, and don't be afraid to ask for that next gift, or at least to start discussing it. If your campaign, annual fund, or major gift opportunity was urgent and inspirational before, it will still be today. Adam talked about this as well. Provide opportunities for your constituents to give to immediate and critical funds. Prospects and donors understand the strain the pandemic is putting on our society and our health systems. So it's important to get the message out there that you are listening and acting in a specific way to ensure that all hands are on deck. Don't forget to be specific where, how, and when the funds will be distributed. Transparency is key. It's also important to take the long view. It can be easy to panic and focus on the short term, but taking a more strategic approach pays off in the long run. Nonprofits should focus on maintaining relationships with all of their donors. They should, review their portfolios to identify donors who aren't currently major gift prospects, but who need additional qualification and cultivation to move them forward to becoming major gift donors. They may not be ready to be asked for a major gift at this particular time, but you want to be moving them toward that possibility when the time is right. It is also a good time to leverage technology in your fundraising and engagement efforts. Consider incorporating video conferencing, live streaming, or virtual briefings to make meetings more dynamic and create more personal experiences, regardless of where your colleagues are at. Maximize your use of social media via ambassadors, or what they have social influencers these days, and they can be cultivated to create a core group of passionate, connected supporters who can help spread your mission. And speaking of technology, this year is going to be rough for event organizers. I think we can all agree on that. If your event is coming up soon, you'll likely have to cancel or reschedule it for a later time if possible. Some vendors and sponsors are forgiving during this time, so you should review contracts and insurance options to determine if you can get a credit or a refund. Having said that, now is also a good time to build your chops on running virtual events. It will require planning and practice, but you can reach many thousands of attendees that would be very difficult to gather in person. And you never know. You might even decide to keep hosting them as a complement to your physical events long after we found a vaccine for COVID-19. It's also important for fundraisers to understand the organization's financial position and be able to confidently address questions related to fiscal health. Questions related to operating reserves or days cash in hand may be more significant at a time of uncertainty. And you may also want to consider being flexible in your approach to pledges for folks who may not be able to fulfill their pledge amounts, at this moment in time. It's also important not to forget your internal audience. Physicians, nurses, other caregivers, even your staff are being stretched thin to the brink at this time. Encourage them by finding ways to share stories of donors who've invested in your institution. They may feel like they're in this battle alone, but it is important to connect with them on a regular basis to assure them they're not. I think there would be any better time to remind these internal partners of yours of the dedication and commitment that philanthropic investors have to them and their work. Also, like Adam mentioned earlier, I wouldn't rush to adjust your direct response calendar. Use appropriate messaging to acknowledge this difficult time and share your organization's response and impact on the community. As an example, I was managing the annual giving department at a nonprofit in 2008 during the Great Recession. I knew my previously approved budget would be reduced by leadership, but instead of removing appeals, I segmented target lists, included relevant messaging, and coordinated all the channels I was working with. Yes, the dollars were short at the end of that fiscal year, but participation remained steady. I also saved on expenses by targeting fewer constituency groups, and saw an immediate uptick in numbers in the following year. And finally, it's moving fast every day. We all need to remain nimble and be prepared to change courses and pivot effectively in response to both internal and external changes. And with that, I'd like to hear from you. Yeah, go ahead, Adam.
I just want to add one more thing to this, because I just had a interaction with the client this morning about this. Some might be having, if you've been in an initiative or a campaign where you've been collecting multi-year pledges, we've gotten questions about what's the attrition rate that we might see over the next year or 2 years. In quote unquote normal times, we don't see attrition rates certainly higher than 3% for pledges that are documented, signed, and recorded in your system, and really it's almost less than 1% in most instances. That said, if you had to go through a planning exercise, I think the high end of conservative planning would be for 5% of attrition on any pledges that you're tracking on an ongoing basis. So just wanted to offer that as an additional data point for anybody going through that particular kind of planning.
Great, thank you all so much. So we will now be taking audience questions, so please send them through the questions box in the GoToWebinar control panel. We also invite you to share your experiences and how your organization has been responding to COVID-19, so we hope you send those through as well. So our first question is, we are embarking on a capital campaign and are wondering if it's appropriate to move forward with funders during this time. How do we do that and be sensitive to the current environment?
Yeah, it's a great question, and this is not entirely different from the way that you should continue to be in conversation with donors on an ongoing basis during this time. You don't want to reach out ignorantly or without acknowledging the current societal context and what we're all going through. So that caveat at the beginning of messages in regards to what you're trying to accomplish is very important. And again, asking people how they are doing and listening in response, and then adjusting your outreach appropriately. But this is a great time to be asking people for advice and engagement. We launched a survey to 15,000 constituents of one of our clients just the other week. We had one of our highest response rates on record and coming back from that survey. So people are anxious to provide input at this moment in time. And so if campaign planning aligns with strategic planning that your organization is engaged in at this moment, we would encourage you to move forward as long as you can support the active communication with the constituents that you'd like to engage in that planning.
Yeah, Adam, I'm hearing a lot of the same thing, and in some cases, organizations are leveraging their volunteers or their campaign volunteers in a more significant way because those personal relationships are already strong, and it's a good place to build and kind of navigate where a donor feels comfortable going within a conversation. So I've spoken with a couple of organizations that are really thinking strategically about engaging those volunteers that are comfortable having conversations today and reaching out to their friends and keeping them involved in the campaign.
Yeah, agreed. I think it all depends on where your constituents are at that donor stage. Many folks who've had meaningful conversations with fundraisers are in a position where they're open to having a discussion of what the institution is trying to accomplish. So it's always important to have those conversations with your prospects and not feel that we should just be avoiding them right now altogether.
Thank you. Our next question is, for peer-to-peer fundraisers, how should we proceed in asking people to raise funds during such an uncertain time? Also, what is the average estimated decrease should a fundraiser like this anticipate?
Yeah, that's another good question, and it's really dependent on the organization and the venue through which you're engaged in peer-to-peer. So a number of organizations have shifted those events to virtual. And so that's a strategy to consider. I think the percentage decrease that you might have to build in, again, is based upon your history of that event and what kinds of returns you've seen generally.
Great, thank you. Our next question is, we are in the middle of our strategic planning process. It's become clear that this crisis would impact our goals. Should we stop and pick up again later, change our goals, or something in between?
I think if you're in the midst of a strategic planning process, you've done the good work to identify objectives and specific goals for your organization. So I don't think that it's appropriate or wise to throw those out the window just because of I don't want to bump the road, but this new circumstance that we're dealing with. So I think it's what we would encourage you to do is acknowledge the moment that we're in and the impact that might have on your organization financially, programmatically, or otherwise over the next year, and build that into ongoing plans that you had already been working on.
So we're working with a healthcare organization that was in the midst of creating their campaign messaging, and we're finding that those messages are only enhanced by the current climate. So to the extent that you're in the middle of a strategic planning process, you might need to focus on more immediate response to the current climate and what you're doing, and then build on those immediate strategic priorities and that immediate messaging to support your longer term strategic planning and communication.
Great, thank you. Our next question is, do you have any tips for Givingtuesday now?
Yeah, I think, and I think we've got some content on this that we can either push out to this audience specifically, or that might be on our website as right now. But I think importantly, if you want to consider if you have the infrastructure to respond effectively, getting something up and moving forward with a Givingtuesday Now initiative. If you do, then I don't think that there's any harm in doing so. I think probably the number one thing to be considerate of is that you're engaged in it around genuine need, right? So you don't want to be perceived as taking advantage of this particular moment just to raise funds. And I think we've all been cognizant of that as we develop COVID specific funds. So that's probably the most important thing. One, consider how it fits into your existing or ongoing plans if you have the logistical infrastructure to support it. And then can you create a case that's really genuine around this specific moment in time? And I think you could extend, as a part of that, you could extend any COVID related funds or initiatives that you've already set up.
Yeah, Adam, I've also, we're working with one client who's shifting the messaging a bit. So including the giving aspect, but making it more about caring as well. So care within the community and what that means to connect all of the constituents, both the frontline workers as well as the donors and other staff who might have participated in a Givingtuesday day. So thinking, just outside the box about what Givingtuesday means and what the purpose is, and including fundraising messages in it, but perhaps there's a greater message that's being told and really headlining your Givingtuesday efforts as opposed to the direct ask that it typically is.
Great, thank you. Our next question is, with many clinical research trials and projects halted due to current circumstances, what are some creative and unique ways we can still steward donors over the next few months?
Yeah, this is a really great question. I think something we tried to allude to as we went through the initial slides. We're hearing this a lot, wherein somebody who was focused on a specific area of health being deprioritized given the response to the virus. Like, what are we supposed to do, right? And from my perspective, there's never enough cultivation and stewardship that you can do. So you've been granted a period of time wherein you can deepen a relationship with a prospective donor or funder, build upon the conversations that you've already had, and ensure that everything that you've discussed to date is still relevant relative to their current situation and ongoing planning. And ask them what else you can do for them at this moment in time, right? So if you're putting a pause on moving something active forward, or you have to extend a period of time through which you're cultivating them, it gives you the opportunity to maybe pivot ever so slightly and provide them with additional benefit, information, access to other colleagues or individuals within your organization.
Yeah, to piggyback off Adam's comment as well, now's a good time to conduct some of those care calls. Reach out to some of your prospects that you're trying to qualify and cultivate, just to check in on them. Like I said earlier, show empathy and compassion, and share how the organization you're representing is making an impact during this uncertain time. The other thing I would also add is that by virtue of these clinical trials and research projects being stalled, your physicians, some of them may actually have some additional time, and it's a good way to leverage those relationships you have with your clinicians. If you've already had them buying into philanthropy, then to utilize them to reach out to some of your top end donors or prospects, so that they can find, they themselves can cultivate those relationships, steward them, check in on them as well, and then also provide an update as to what they're doing. Just because it is on pause doesn't mean that it's done. They're still working to find a cure, or on doing more research as well.
Great, thank you. So we're at our last audience question. If you do have any final questions or would like to share any experiences with us, we invite you to share those now. So our last question is, I recently started a new role as a major gift officer for a large institution and have inherited a portfolio of donors. I would typically be reaching out to set up meetings and introduce myself. What advice can be given for connecting with these donors initially and starting my own discovery process, given the unlikely possibility of scheduling a face-to-face visit anytime soon?
I think that this moment in time, people are often bonded during times of, unrest or challenge. And so you have a unique opportunity to say, hey, I'm joining in during a time when we really need to strengthen our organization. And so I'm really excited to be able to get to know you in whatever form or fashion may be possible at this specific point in time. And so I think, again, we want to give donors the opportunity to tell us how they would like or would not like to interact our organizations at this moment. So I think don't restrict outreach, but rather engage in outreach that's appropriately acknowledging the current situation and offers the opportunity to listen and build a relationship.
Each time you inherit a portfolio when you first started an organization, your portfolio is about 200-300 individuals on there. All you have for comparison is just the notes that you have in the system, right? Some of your predecessor will have left some copious amount of notes there that you can use to figure out how you want to segment your list. Many times you have to determine on your own what level these folks are at so that you can move them up or bump them down in the short term. And so it's a great opportunity for you right now to take a look at those individuals and highlight the folks that you want to reach out to right now to just start building that relationship. Maybe look at the ones at that leadership level that you want to take to the top, some of the ones that have been cultivated a little further to get to know them a little better as well. Steward them and then just tell them about everything that's going on at the organization. Introduce yourself, you may start building that relationship for yourself so that you're in a better situation down the road, like I shared earlier, to solicit them when the time is right.
Great. Well, with that, we'd like to thank you all for joining us today. We also encourage you to visit our COVID-19 resource page where you can read our advice, review resources, and schedule a free consultation with us. Within 24 hours, you will be receiving a follow-up email from GoToWebinar with a link to the recording and resource page. In the meantime, please don't hesitate to email our presenters with any questions you have. Thank you and take care.
Bye, everyone.